Hello aspirants, I am Indumati Karthikeyan from Inkar IAS Academy. Today we are going to discuss about the 5th February current affairs. The topic taken from the Delhi editorial. The topic is cancer care in India, the financial toxicity of cancer care in India. This topic comes under our GS2, issues relating to development and management of social sector, service relating to health. In this topic we are going to discuss about what is the current issue and what is about cancer, status of cancer prevalence in India, economic cost of cancer, and what are the reasons for cancer prevalence in India, and what are the why there is a need for the yearly awareness and detection, and what are the challenges behind the cancer care in India. First of all, why it is in the news. Genomics informed that precision medicine or targeted therapy offers a right treatment to a right patient to the right time, that making previously untreatable cancer is now treatable. Yet these breakthrough along with the latest treatments such as immunotherapy, monoclonal antidotes, and also there is a proton therapy remain out of reach for many people from low and middle income backgrounds. The financial toxicity of cancer care in India. There is India philanthropy, that CSR initiative, government funding, and also there is non-profiting hold the power to alleviate the economic burden of the cancer care in India. This is the topic today. First of all, according to the data that's shared by the annual Health of Nation reports by Apollo Hospital, India is rapidly emerging as a cancer capital of the world. So, India is fast emerging as a cancer capital of the world. Rise in NCDs in the India, that is a report that lied the rise of the non-communicable disease, but in India will significantly impact the national overall health. And also there is about cancer. The cancer is a disease in which some of the body cells grow uncontrollably and also spread to other parts of the body. The mechanism starts when a gene or several genes mutate and create a cancerous cells. These cells create a cancer cluster or tumors. These cancerous cells may break away from tumors using the lymphatic system or bloodstream to travel to other areas into the body. So there is a many status of cancer prevalence in India. There is a NCD's prevalence deaths around 63% of the death in India. That is 1.39 million number of cancer cases in 2020, 1.57 million expected number of cases in 2025, and 13% growth in 5 years. It's enormous rate. And also there is an economic cost of cancer. That is a cancer have projected the cost India is $3.55 trillion in lost economic output. There are also middle age of cancer diagnostic in India is high. That is a 52 years average age of breast cancer diagnosis in India. That is also 59 years average age of lung cancer diagnosis. 30% share of the color cancer patient aged less than 50 years. That's a cancer scanning rates. There's 1.9% breast cancer screening in India compared to 82% in US, 70% in the UK, and 23% in the China. And also there is 9.9% cervical cancer screening in India compared to 73% in the US, 70% in UK, and 43% in China. The cancer screening is looking for cancer before a person has any symptoms. Screening test can help to find a cancer at an early stage before symptoms appear. There is an extrapolation of Western data in India. The report highlighted that threshold of the prostate specific antigen that blood test Indian men was different from the current standard suggestion, the need of local data. And also there is a rise in the colon cancer. That is, a hospital found that colon cancer cases were increasing among young people with 30% of colon cancer patients at Apollo Hospital aged less than 50 years. And also there's a 50% rise in the prostate cancer. That is a current trend according to the later Lancel Commission paper that prostate cancer accounts for 3% of all the cancers in India. So that is estimated it's around 33,000 to 42,000 new cases diagnosed. So there is a many reasons behind this. First of all, there is a smoking and alcohol use is one of the cause that factors responsible for the 37% of the cancer death in India. And also there's a obesity is a significant risk factor that cancer development. The study linked to the increased likelihood breast, colorectal, pancreatic, and also kidney cancers. That's obesity incidence are increased a percentage of 9%, and there is a many reason behind this obesity, and also there's a unhealthy diet is one of the reason. That is a unhealthy diet like high fat, low in fiber may increase the risk of the many cancer, including there is a bowel, lung, prostate, and uterine cancers. The diet high is processed and red meals can raise the risk of the getting some types of cancer, and excess fat, protein, calories of the diet might raise the risk of the getting cancer. And also besides that, excessive salt intake a long period has been linked to the stomach and gastrointestinal cancers. And also maybe stress is one of the problem, and chronic stress can have disastrous effect on the health, including increase the risk of the cancer. 80% of the young adults and seniors is reported the significant stress levels, and also there's a poor and oral hygiene is one of the reason. Chronic inflammation or infection on the mouth, often associated with a poor hygiene, has been increased the risk of oral cancer. Occupation and environmental exposure is certain chemicals, asbestos, benzene, and radon. These are at workplace will increase the risk of cancer. And infection, the certain infection like human papillomavirus, hepatitis B, hepatitis C, and also Helicobacter pylori. These are the factors which will increase the specific cancer, including the cervical cancer and also stomach cancers, and also lack of physical activity, excessive sun exposure. These are the things will be causes for the main reason of cancer. And also there is a need of yearly awareness and detection is required, because there is a symptoms, lack of symptoms is a main point, that prostate cancer may cause no signs of the symptoms in the early stage, and it is only in the advanced stage the patient report the symptom like trouble urinating, bone pain, and also blood in the semen and urine. These are the things. And also there is a available cancer treatments in India is chemotherapy, immunotherapy, radiation therapy. First of all, the chemotherapy, it has strong chemicals that target the cancer cells. Immunotherapy is boosts the body's natural defense system, and also radiotherapy is used to high energy ray to eliminate the cancer cells. And also there is a regular screening process is required for the cancer patients. So for the very much bigger challenges behind this, first of all, access of radiotherapy. 8 lakh people with cancer will require the radiotherapy each year. The adequately they need to treat it, and also there is a opioid use of pain relief. It is a use of last stage in the another challenge, that is the government adopted stringent legislation to regulate narcotic misuse of the trafficking. As a result, medical use of morphine decreased by 97%, which severely limits the access of the pain management. And also lack of sufficient infrastructure is one of the reasons. The healthcare facility, especially in rural area, lack of necessary equipment, trained professionals, treatment options required for the comprehensive cancer care. This leads to delays in the diagnosis, limited treatment option, and poorest outcome for the patient. And also there's affordable cancer treatment is the high cost of cancer drugs, along with the expenses related to the diagnostic, hospitalization, and supportive care. It will push the patient and the family into a financial burden and distress, which considering the cost across the hospitals, including the charitable and trust fund institutions. Cancer can average of 61,216 per hospitalization, a massive financial challenge for the large portion of the population, and also shortage of the skilled oncologists and healthcare professionals. There is a bulk of cancer treatment centers in cities, while 70% of the population live in rural areas. This is the main cause. And also we have the social stigma. The attached to cancer can lead to isolation and discrimination, severely impacting the mental health and also well-being of the patient. The stigma noted that cultural beliefs and lack of awareness, which will exacerbate the challenge faced by the patient entering the timely and effective treatment. There is a CAR T cell therapy, India's first homegrown gene therapy launched in the cancer of IIT Bombay, that is Pro Health Score, that is a digital health risk assessment tool for the assessing of individual health and well-being of the evaluated factors such as family history. And also Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, that offers the health insurance up to 5 lakhs for the family, and also there is a national program for the prevention and control of cancer, diabetes, cardiovascular disease and stroke, that is NPCDDCS. It's aimed to prevent the control and chronic non-communicable including cancer. So moreover, we have Rashtriya Arogya Nidhi. It provides a financial assistance for the patient who living below the poverty line, and also there's a state illness assistance fund step by various state government official financial aid to the poor patient to cover the treatment. The way forward to increase the investment in the research and development will definitely address this problem, and also we need to include the novel therapies to targeted therapies and also immunotherapies, and also enhancing initiative like NCG through pooled procurement and also providing comprehensive training and healthcare workers can maximize the utilization of the resource, and also there is a replication and integration of the successful initiative like Tata Memorial Center. These are the main initiative we can take forward. We can reduce the cancer, we can reduce the financial burden of the government. Thank you so much.